On behalf of the Drug Information Association, I would like to welcome you to today's webinar titled From the Clinic to CFO, Adaptive Trials and Financial Decision Making. This solution provider webinar is brought to you by DIA in cooperation with Cytel. After the webinar is complete, you will receive an email containing an online survey link. DIA is committed to developing quality educational programs that meet the needs of its members. Your feedback is greatly appreciated as the results of these online surveys are used to plan future programs. Question and answers will be taken after today's presentation, but please feel free to submit your questions at any time by using the question and answer box. The question and answer box is located in the lower right-hand corner of the screen. Today our speakers are Nitin Patel, Chairman, Founder, and CTO of Cytel Inc., and Frank David, Managing Director of Pharmagellan. At this time, I would like to turn our webinar over to Frank, and everyone can enjoy the webinar. Frank, you do have control of the PowerPoint presentation at this time.
Great, thanks so much. Again, my name is Frank David, really happy to be here. Just as a brief intro to give some context, I'm a consultant who works primarily in the commercial business development and R&D strategy sides of life sciences organizations, and come at this from previously a history of clinical medicine and basic science, and then many years as a consultant within an investment bank, and then a couple of years in an industry R&D position doing R&D strategy in oncology. Nitin will do his intro in a second, but in a few minutes, but really this whole idea came together because we found that our perspectives on clinical development decision making kind of intersected at an interesting point. So I come at clinical development decision making more from a business strategy, financial analytics, and partnering perspective. Nitin, as he'll talk about in a few minutes, comes at it more from an R&D trial design and trial execution perspective and portfolio management perspective, and those two things come together. And that's really what we want to spend this talking about, is really to explore what's interesting about that intersection between trial design on the one hand and financial and corporate strategy on the other hand, and really how those can be used in novel ways, both in small companies and in large companies. So let's go to the next slide.
Maybe I could say a few words.
Oh, yeah, sure. Maybe Nitin will introduce himself first. Sorry.
So just a few words. I wanted to add to Jessica's introduction that I have a PhD from MIT in operations research, and I'm a fellow of the American Statistical Association. I've been interested in adaptive designs for some time. I've been involved in developing software and tools and doing some consulting in that area. And I've been particularly active with the DIA Adaptive Design Scientific Working Group, which, as you know, has done a lot of very interesting work in making adaptive designs really practical and to use, and checking out the pros and cons in various studies. I've been interested in I have an MBA also, so I've been interested in the financial side, and it's really my first paper, I guess I published more than about 10 years ago, perhaps 8 years ago, on trying to link design, statistical clinical trial design, with what the financial outcomes would be, risk and return, to sponsor companies. So that's just my background.
Great. And just I'll make one final note, which is the work that we're talking about today. There are some other collaborators who we've had along the way. And I just wanted to especially call out several collaborators from Ernst & Young's Life Sciences Consulting Division, who were enormously helpful and did some of the analyses here, as well as some collaborators that we've had within large pharma R&D organizations who have helped us both in terms of framing the questions and in terms of some of the inputs. Good. So with that background, I think we missed one. Oh, we're missing a slide. That's okay. So go back. So, I think that's fine. Stop. There are some interesting questions, both from the point of view of being inside a company that's developing drugs and also being an outsider looking in terms of potentially funding these drug development efforts. And they do come together in some ways. So these are some examples of the kinds of things that probably a lot of you have heard in terms of strategic questions within a company that's actually trying to develop drugs. And inherently, there are several trade-offs that need to be made in terms of speed, the cost of running the R&D, the probability of success, and also the ability to, over time, be able to manage your risk. If you think about it, actually, those are much the same, many of the same kinds of concerns that you have as an investor. And by investor here, we can use that kind of in a broader sense to mean both an external investor, so many people would call it, quote unquote, a VC. It might not actually be a venture capitalist, but someone who's putting financial capital at work to get financial returns. Or you have the chief financial officer of a biopharma organization. That person's interests are a little bit different. They're clearly putting financial capital to work. They want to get financial returns, but they also want strategic returns as well. Going back to the financial question, again, whether you're the CFO looking at this through a financial lens or whether you're an potential external investor, though, there are really 4 fundamental problems with investing in clinical development as it's conventionally done. The first is it's just really expensive. I mean, there's just no getting around it. The second is it takes a really long time. And the third is that it's unbelievably risky. And when you put all those together, you get to the 4th problem, which is essentially that from a financial perspective, you're locking up your investment for a long period of time in something that's high risk. And essentially, you're being told that at some distant point in the future, someone will tell you what you won, if anything. And if any of you have thought about this from a financial perspective, you realize those are all the makings of a really bad investment, because really what investors want are the ability to understand risk, to modulate risk, to not have their money locked up in things in which they don't have an understanding of the investment for a long period of time. So that really unites in many ways the kinds of issues that both the financial investors, the potential external financial investors, but also internal financial / strategic investors have when they look at R&D. So, so really what we would like to do here is, we are missing several of the slides. Keep going. Yeah, we are missing every other slide.
That's right.
Jessica, actually, if you look at the numbers,
okay.
Every other slide is gone from the file that I sent.
Okay, give me 1 second and I will take this out and re-upload it.
Thank you.
Sure.
Sorry for that. I'll just riff a little bit while because I can carry on without the slides, so I hope people will just bear with me. Really there are 3 fundamental challenges that Nitin and I have been working on, and we do believe that putting financial analytics together with adaptive trial design, we can help get over those 3 challenges. So the first one is that fundamentally the quote-unquote financial investors, again, whether it's the internal C-suite, the CFO, et cetera, or whether it's potential external investors, often don't understand that there is, in fact, a relationship between trial design and what they would normally look at as financial metrics, the return on investment, the internal rate of return, et cetera.
In fact, the trial designs rarely talk about dollar signs. It's always about power and significance.
Absolutely.
Nowhere is there a dollar sign.
Absolutely. And I would say that in my experience, the only place a dollar sign is mentioned is just talking about the total cost, right? So traditionally, if you're in for any of you who have been in large pharma companies or are in large pharma companies, you will recognize the situation of essentially, going to kiss the ring and showing your trial design and saying, therefore, we want X amount of money to be able to do trial design Y. And that's very unsatisfying for both internal, quote-unquote, investors as well as external investors So one of the keys is really finding ways to better integrate both the trial planning with the analysis of relevant financial metrics that matter to the people who are actually deciding whether to fund the trial. So that's part one. And again, although adaptive design is not necessarily required for that, it does, as we'll talk about in a second, give you more degrees of freedom in terms of doing that. The second issue is that we talked a moment ago about the different types of concerns that investors have. And one of the challenges is that often when the R&D organization goes and tries to, quote unquote, design a trial, there's often little insight in terms of what actually are the pressing needs in terms of the financial decision makers. Is the pressing need in this case managing the cost? Is it managing the risk? Is it increasing the total value of the program? Is it getting there faster? What is the burning desire? And so that also is something where adaptive design, again, is not critical to that, but if you understand that, and if you have actually that transparent discussion of what the strategic goals are, then adaptive design helps you to enable and to sort of maximize for that variable. I would say the third thing really comes to the heart of what we're going to be talking about in this program, which is that the chief financial officer and the investors often view R&D as a little bit less attractive as an opportunity, in part because they are presented one option to basically vote up or down that is unattractive for the reasons I just described. And really that comes to the heart of what Nitin and I want to talk about, which is that by using adaptive design and really iteratively going back and forth between adaptive design and the financial analytics, one can actually not just develop options, but actually analyze and refine them and make them investable. Okay, I'm going to take a second while we figure out whether we have all the slides. This is looking extremely promising. Excellent. This was a slide I missed with the beautiful graphics on the left. So we'll just give that due homage, and now we can keep going. One more. So this is what I was just talking about. Again, the problems that Nitin and I have been wrestling with and really trying to solve. And then on the next slide, this is really the structure for the remainder of the presentation. So we actually have two case studies that we're going to show that talk about how one can link adaptive trials to financial decision making. So in the first one that Nitin's going to present, this is one which stemmed from a biotech company that was really trying to manage risk and cost and try to make its trial more, quote unquote, investable. And Nitin will talk about the strategic questions and also how his team helped to solve those questions for the company. In the second case, I'm going to present a little bit on a case that actually came from a larger pharma company, which was really in terms of helping to understand and define what the trade-offs were between costs and benefits for an R&D decision-making organization. Now, one final point I'll make just before we get into the cases is that although one of these is more of a small company, is an example taken from a small company, and the other is an example taken from a large company, actually the issues that are raised are totally transferable back and forth. Because again, the central question about the fact of trying to come up with designs and ways of analyzing the designs that can bridge the gap between R&D and investment really transcend whether you're at a small company, large company, looking at internal investment or external investment. So with that, I will turn it over to Nitin, and we'll go through this first case study.
Thanks, Frank. This case study, as Frank said, is about a small biotech, and let me give you some context about it. They had a pivotal trial that they were designing for a lead asset. The asset actually had promise for many other indications than the one that the pivot trial was focused on. But they had limited resources, and they wanted to explore what could be done in terms of getting external investment to enable them to do justice to the asset that they did have. So the goals that they set, apart from the usual goals of clinical trials, were to see if one could have a staged trial investment so that investors could somehow de-risk or appear to take less risks in their minds than would be the case if they just simply agreed on a share of the standard fixed design. And also to clearly indicate in financial language, which is quite different from the statistical language that we are used to as good trial designers, the risk and reward profile for that trial, in particular to the investors, and make it attractive to them, and actually negotiate in such a way as to see whether one could come with terms that would be attractive to both parties. So the company is actually Sunesis Pharmaceuticals. This is all public data that I'm using, so you can go on the web and find much of this information. This is a poster from ASCO, for example. The study was the Valor study. That was the name of the candidate drug. And the idea was to have a double-blind randomized clinical trial of Vosaroxin, which is the study drug. And the indication was first relapsed or refractory AML, acute myeloid leukemia. The idea was to have a one-to-one randomization, a two-arm study between a study arm and a control arm. The study arm involved treatment with Vosaroxin, the study drug, and the standard of care, cytarabine. And the control was the study of care, standard of care and placebo. They went through treatments, induction and consolidation cycles, and then patients were followed up for overall survival, which was the endpoint that they were looking at and which was agreed upon with the FDA. Incidentally, the drug Vosaroxin was considered an orphan drug and had fast-track status, so they did have that advantage.
I would just make one quick point there, which is I think one reason why oncology is particularly interesting for the types of approaches we're talking about is, as many of you probably know, oncology more and more is going after smaller indications, at least initially, and the kinds of metrics that would have been used historically 15 years ago to figure out, should we run our big trial for a lipid-lowering agent, for example, the numbers at the end in terms of the potential market size are so much smaller that that it becomes challenging to make sort of conventional, the math work out with conventional trial design. So again, I don't think that we're making the point that this is really only suitable for these kinds of situations, but I do think there are unique aspects of smaller indications that make them particularly interesting for the types of trial designs and pairing with financial analytics that we've been working on.